Hello everyone, welcome to my presentation on asthma, whose ICD-10-CM diagnosis code is J45. My name is Erwin Arizo. I am a member of your Spring 2023 cohort at Harper College in the Health Information Technology program. The purpose of my presentation is to educate students and adult learners in the health information management community about asthma, and to review information on diagnosis, treatment, and testing pertaining to clinical coding. By the end of this presentation, you will be able to define asthma and understand its basic etiology, identify the signs and symptoms associated with the disease, describe the commonly used treatment options and medications, recognize the lab and diagnostic tests used for asthma, locate the correct diagnosis code, and any coding considerations for asthma in the ICD-10-CM 3M Integrated Codebook, and refer to the ICD-10-CM official guidelines for coding and reporting as provided by the CMS and NCHS, and see what it says about asthma. Asthma is a pulmonary disorder indicated by inflammation of the airways to the lungs, resulting in bronchoconstriction. Bronchoconstriction is a tightening of smooth muscle surrounding the bronchi and bronchioles with consequent wheezing and shortness of breath. In terms of etiology, the onset of asthma is dependent on more than 100 asthma susceptibility genes that are vulnerable to environmental triggers. According to the CDC, some of the most common triggers of asthma include tobacco smoke, dust mites, air pollution, cleaners or disinfectants, some medications, respiratory infections, allergies, acid reflux, exercise, and even strong emotions. Asthmatic exacerbations cause dyspnea, chest tightness, audible wheezing, coughing, tachypnea, pulsus paradoxus, visible efforts at respiration, and speech difficulties. As you can see in this message from the National Heart, Lung, and Blood Institute, there is no cure for asthma, but it can be controlled through treatment. The treatment of asthma typically focuses on the control of triggers, drug therapy, patient education, and treatment of acute exacerbations. Drug therapy is centered on two classifications of drugs: anti-inflammatory drugs and bronchodilators. Anti-inflammatory drugs can include corticosteroids, leukotriene modifiers, and mast cell stabilizers. Bronchodilators can include beta-adrenergic drugs, anticholinergics, and methylxanthines. In rare cases of severe asthma, immunomodulators are prescribed, like omalizumab, which directly changes the immune system. These prohibit certain substances in the body from causing inflammation. For lab and diagnostic tests, it can include the following: pulmonary function tests, spirometry, peak expiratory flow meter, and flow volume loops. The woman shown in this photo is undergoing a spirometry test. This test measures how much air you can breathe in and out of your lungs, as well as how easily and fast you can blow. Next, let's take a look at the coding considerations for asthma. We will first look in the 3M ICD-10-CM codebook, then in the ICD-10 official guidelines for coding and reporting provided by the CMS and NCHS. In the 3M codebook, I will start at the text search in the tabular and type asthma. and then press enter. The search results here on the left show J45-asthma. The dash means it is incomplete. I click on that. We note that there are 9 includes, 7 use additionals, 4 excludes ones, and 3 excludes twos notes for asthma. Let's see what the coding handbook has to say about coding for asthma. We start by pressing here and click on asthma. So in the coding handbook, one key consideration for asthma is that the numbers that follow J45 will indicate more details about that patient's diagnosis. The 4th character indicates the severity level and persistence of the condition. The final character indicates either an uncomplicated condition or an acute exacerbation or status asthmaticus. If both acute exacerbation and status asthmaticus are documented, only the code with the final character 2 should be assigned. For example, if we search in the index for asthma, mild persistent with status asthmaticus, we get code J45.32. This slide shows the different numbers associated with those different levels of severity. Here's my example. Next, we want to see what the coding clinic's response is on questions about how to correctly code asthma. We start by pressing here. Then I press the binoculars and a search box will appear. I enter asthma in the search box and press search. These codes that start with a number from here to here are before the year 2016. These codes that start with either the letters J or Z are from 2016 and later, of which are regarded as relevant to this assignment. These are those 6 coding considerations, listed in chronological order. Lastly, let's refer to the ICD-10-CM official guidelines for coding and reporting as provided by the CMS and NCHS and see what it says about asthma. We start by pressing here. I performed a word search for asthma, and we see that I'm brought here to Section 1, Part C, Chapter 10, Subpart A1. I click on it, and it explains in Subpart A1 that for both codes J44 and J45, what an acute exacerbation is and is not. Thank you for listening to my presentation about asthma today. Let's review the learning objectives that I set out at the beginning of this presentation. Define asthma and understand its basic etiology. Identify the signs and symptoms associated with the disease. Describe the commonly used treatment options and medications. Recognize the lab and diagnostic tests used to diagnose the disease. Locate the correct diagnosis code and any coding considerations for asthma in the 3M ICD-10-CM codebook. Lastly, refer to the ICD-10-CM official guidelines for coding and reporting as provided by the CMS and NCHS and see what it says about asthma. Since my early childhood, I have had a history of dealing with asthma. So speaking about it today made a personal connection, and I hope my presentation made a connection with you too. Thank you for watching, and breathe easy.